is Vinod, and I'm a developmental and behavioral pediatrician at National Institute of Physical Medicine and Rehabilitation in Thrissur, Kerala. As you all know, the schools across the country have been closed down and parents and children are confined at their homes. And if you are a parent of a child with special needs, you will know that this is an especially challenging time for you. And this is because of the change in routine. So in order to help parents tide over this difficult period of lockdown, and also as part of the World Autism Awareness Day, that's today, April 2nd, the wonderful team of professionals at Nipmr has created these short segments to teach you some tips on how you can help your children at home. I don't have to tell you that being at home with your child can take a lot of patience, creativity, resourcefulness, and positivity. So do what you can to take care of yourself first. Take that extra cup of coffee, watch a movie while your child is asleep. Get in touch with your support group if you are part of one. You may or may not feel like it, but we are all social beings, and connecting with other people that have similar problems as you do can definitely help a lot. Children on the autism spectrum thrive on routine. So create a visual schedule, use a timer. Get help from your family members. If you have an older child, get his or her help to take care of the chores at home, as well as to engage your child with autism. If your child is on any medications, make sure that you have enough supplies of it. If you do need more of those medications, make sure to call your doctor's office. There is a way to fill these prescriptions online. The doctor can either write a prescription, take a picture of it and send it to you on WhatsApp, and you can fill it on the pharmacy. This has been approved by the state government. So focus on all the positives that will come out of this unexpected break. This is a time to connect with your child, teach him or her the life skills that he needs, and possibly activities of daily living that you have not had chance to work with. I hope the next few segments of videos will be of help to you and will benefit your child as well. Thank you.
Daniel, occupational therapist at National Institute of Physical Medicine and Rehabilitation. Lockdown can be a very difficult time for everyone, especially for parents and children with autism. Parents might be worried about missing therapies. While your therapist can help you in assessing and evaluating your child's needs and setting goals, parents play a very important role in implementing these goals. Let's discuss few occupational therapy activities that can be done at home. All these activities can be done with materials easily available at home. Make a sensory bin using various materials like cotton balls, marbles, pebbles, different kinds of beans, blocks, etc. Ask your child to use a tweezer or tongs and sort these materials. Use Play-Doh or chapati dough and encourage your child to roll it, squeeze it, pinch it, cut it with a knife or a child-safe scissors, and make different shapes. Paper and scissors activities, coloring, painting, or writing on a vertical surface like on a paper attached to the wall or on a window will promote fine motor skills and proximal stability. You can ask your child to lie on his tummy and do different art and craft activities like finger painting or vegetable printing. Promote independence in all basic self-care activities like dressing, eating, bathing, brushing, toileting, etc. Involve your child in simple chores like dusting, sweeping and mopping the floor, and washing vessels. Let them sort and wash vegetables and cut it. Encourage them to participate in simple cooking activities like rolling a chapati or making a dosha. Use this time to teach them various safety precautions as well. Take your child to the garden. Let him run and play or ride a cycle. Make them water the plants, smell the flowers, and walk on the wet ground. Make an obstacle course at home. Make your child walk on a line, do various crawls or animal walks, jump on pillows, throw balls into a basket, climb on chairs and jump down, or creep under a table. Don't forget to make it purposeful by making your child do a puzzle or some other goal-directed activity. All these activities promote sensory modulation and self-regulation, which in turn will help your child learn new skills and adaptive behaviors. Don't forget to have fun. Sing with your child, dance with your child, be silly, make faces. Be creative, sky is the limit. As Dr. Sears said, think left and think right, and think low and think high. Oh, the things you can think up if only you try. Happy quarantine and happy learning.
So this is April 2nd. Worldwide we are celebrating this day as Autism Awareness Day. At present we are at a situation of or at the phase of lockdown due to the fight against the global crisis, the pandemic COVID-19. On the flip side, for the people who are sitting at home having free time, this time could be used as more constructively in a positive sense. Okay, coming back to our topic, that is autism. I personally don't believe that autism is a new term to our society. But yes, miles to go ahead to reach a level of acceptance where our autistic kids too could function in our society effortlessly. So in this video, I would like to share some of the tips to the parents of autistic children who have difficulties in communication. So my first tip is a general one, that is understand and accept the condition. Once your child gets diagnosed with autism, try to gather knowledge about what is autism. Autism, in a nutshell, autism is a neurodevelopmental disorder with a significant difficulties in social interaction, communication, repetitive behaviors, and there will be overall difficulties in cognition, physically there will be difficulties, and social, emotional. So all these things will be affected in different ranges. So though it's painful to say, some organically based difficulties that define autism are not totally reversible. But we can stream the children into our environment using a lot of adaptive methods and assistive technologies. So I have to tell our parents, don't lose your willpower. Please be patient and hardworking. We are there to support you. And the second one, it will be specifically for communication. Try to tempt child's communication or try to enhance child's spontaneous communication. Being a parent, it is very natural to satisfy a child's need without any intent from child's part. And the fourth tip that I would emphasize is whenever you try to teach something, start from a very easy level to a complex level. If you want to teach a word hi, so what you first is doing will be taking gestures like hi, and then slowly fading to just the word hi. This is because it's for a child with autism, it is very easy to imitate a gesture than a word most of the time. So from, as I said, every time, even if we are trying to teach a sound or a word, we'll go for a very easy modality for the child, and then from there we will fade slowly to the word. So keep that in mind. So these are the tips for today. Hope these are helpful for you. Thank you.
My name is Jessina. I'm working at National Institute of Physical Medicine and Rehabilitation. It is a time we all are restricted and asked to stay at home. So in this period, even if it is a lockdown period, it is an open up period for the children. Because they have more time at home, they have more time with their parents, they have more time with the siblings, and they have more time with all the members of the family, because all of them will be together at the house. So consider it as a great time with your family, because
For the parents who doesn't know their children's strength and weakness, it is the best time for you to know your child's strength and weakness. Managing some of the children's behavior seems to be difficult for some parents, but you don't have to consider it as a difficult thing, because you actually always, the child will be with you, so you have to know how to manage their behaviors. Each behaviors, you have to know why they show certain behaviors and why they behave in certain behavior, in certain way. So in order to manage their behaviors, the first thing is that you have to not stress them, because stressing them can create more problems in their behaviors. So it is better you keep them calm and manage those behaviors properly. To stress on some points which you have to try to work on child's behavior, that is communicating with them. Communicating with them is so important for their development, so you have to communicate with them. So for that you have to talk to them a lot. Keep on talking to them, let them respond in the way they like. So that will be helping in developing their communication skills. Next is give them small responsibilities like cleaning, folding clothes, gardening, like household chores, etc. So that will be helping them to give some activities, to manage certain activities and improve their responsibilities. The next is that give them more options. Giving them more options in everything. Even while wearing clothes, just show them two clothes and ask them which one to wear. So like they will have a decision making skill, and they will have they have some options to choose from something. That is very important for them. The next thing is that sometimes the child may show some tantrums, anger, irritability, which may be not because of their negative behaviors or negative things they have. It is just because they may be physically, they have some difficulties, or like some stomach ache, headache, something, or even they may be hungry. So it is like maybe sickness and hunger can make them irritable. So we have to understand why the child is showing certain behavior. So we have to behave in a way that we understand the child. So empathy is so important in dealing with the child. There are certain negative behaviors like attention seeking behaviors, stubbornness, etc. These behaviors must be totally ignored. So that is very important, and you have to ignore this little small mistakes done by your child, because if you focus on those small behaviors, that can create higher negative impacts. So that has to be stopped. The other issue that we can see at home is sibling rivalry. Sibling rivalries can be stopped at this correct point of time, because you can bring the children together, you can make them play together, you can make them as a team, and then appreciate them for the activities they are doing together in a group. So these can be very helpful. The main thing what we have to do is that we have to reward, appreciate them by giving gifts, by giving food, by giving whatever they are desiring to. It is the best time to teach your child social skills. So social skill can be taught like teaching them social smile, greeting skills, teaching them turn taking, imitation, observation, knowing ourselves and knowing others. All this can be taught right now to the you can also give some activities to your child like cutting, mixing grains, sorting them, paper cutting. In order to teach shape concept, you can make them to cut some shapes, stick onto some like common shapes. So these activities can also help them to improve their concepts as well as to improve attention and concentration. Let us all stay in tune together to bring up our children, because parents are the mini therapist of the child. Okay, so let us all stay safe together for all our well-being. Thank you so much.
My name is Jasmine. I am a social worker. During this period of lockdown, it is very important that you people are aware about the availability of resources in your community. If you have any trouble in transportation, food, or getting medication, get connected with your local panchayat and ask for guidance. If you need to talk with someone or to get help for your child, do call your doctor or psychologist or any therapist, like for example occupational therapist, speech therapist, or physiotherapist, or even a social worker who knows your child very well. And if you are a member of any support group, keep touch with your friends in that group, and always talk to someone who understands, or someone who face similar situations will definitely help. And also remember to get help from your family members, and If you have any older children, uh, assign duties around the house and also help to engaging your child with autism. Thank you.
Today is April 2, 2020, World Autism Awareness Day. At this time of lockdown, we are taking a moment to pause, to consider people who live with autism, to congratulate their parents who have been taking care of them so well. We know it's difficult at this time if they're not getting their regular therapies, not being able to go outside, but taking or doing everything they can to take care of them during the situation. Even though this year's theme is transition into adulthood, we do think that you can incorporate components into your daily routine. It's my urge to parents and to teachers, please consider their special abilities in their day-to-day activities. To the policymakers, do consider them when you're making new policies. As we are building a new world, I take time to let you all know that Nipmr, National Institute of Physical Medicine and Rehabilitation, is with each and every one of you. Thank you.